Good morning. So I'm gonna perform a postural drainage and percussion. So once you do those therapy is first and foremost check the patient's chart and make sure you obtain any information, and then another thing is make sure we also have to view the chest x-ray, especially if what the affected area is, so that we can properly do the proper therapy to that patient. And then once inside is we always have to wash our hands, introduce ourselves, explain to the patient that this therapy or procedure would help and aid them mobilize or clear up their secretions, and with the proper positioning it would also be more helpful due to its positioning and its gravity to their position. So one position that I would like to do was to do like a superior segment on the back, so wherein the patient would lie prone. So the patient should always have a pillow uh, under in front on top, and also on their legs, which would help support. So with this position the bed should be laid flat, and then when first is before I position the patient, always make sure we check the ID band for the patient to obtain any confirmatory purposes, and then make sure we always do vital signs, check the SpO2 and the heart rate, and make sure we always do our auscultation to confirm for what really is the affected area. And then once I'm done with those, make sure we wear our gloves, and then we make sure we have a kidney basin or a sputum cup in place, just to ensure that if we do obtain a specimen. So moving on, so that's what I position to this patient with a superior segment, so wherein there's a pillow both on top and underneath, so in that way we will able to percuss the affected area. So with this we always have to percuss on about the middle lobes, so make sure we avoid any complication or contraindication, such as the patient does have came surgical wounds, especially for females, the breast, we should avoid that, bony structures, even the spine, and also if the patients who just came from a pacemaker, we should also avoid in doing percussing also. So when doing the percussing part, so make sure if we have that the rubber thing, which what we call the percussor cup. If we don't have those, we can also have using our bare hands. So we also have to position our hands. A cup hand should not be a flat, so it should be positioned like this. So ideally every position should be done about 3 to 5 minutes. So if this is the affected side, you have to percuss the patient like that, and then every time we do this is after we do the therapy, we have to reposition the patient in a sitting upright position, and then allow the patient to cough, so that way it might be able to expectorate some sputum. So after that, we always have to take note of its vital signs, such as the SpO2 and heart rate, reauscultate the lungs, especially potential outcomes for this is it might be improvement of breath sounds, and also improvement of your chest x-ray. And then also another important detail for this procedure with the postural drainage and is that we should avoid complications, such as my patient might be having any pain, or might be desaturation or hypoxemic, or maybe vomiting. And then when doing this also is make sure we always do it before meals, an hour before meal time, to prevent any aspiration or vomiting. And if the patient just came from eating, we always do this therapy about 1 hour and a half to 2 hours before after meal time. And then another thing is if the patient does just came from a nebulization treatment, it would also benefit them right after nebulization treatment, as because the secretions are being loosened up. So once done, once we did their vital signs, once what we observed, we always chart it to the patient's chart. Make sure we note the color, consistency, and amount of the sputum. If what our observation to the patient, if they improve a lot, and then make sure we communicate it with the physician, and make sure all of what we did to the patient should be charted to their patient's chart.